So the World Health Organization said, in order for people to understand healthcare system, they consist of 6 building blocks. You can call them pillars. Just like any building is supported by pillars. Healthcare system has got 6 pillars, which the World Organization called 6 building blocks. Number 1 is leadership and governance. Now, any institution without good leadership and good governance will collapse. I'm sure you also know that. The second is access to essential medicines and other commodities. Of course, if you go to a hospital and they tell you that we don't have medicines, we ran out of needles and all that, the population will feel that there's something wrong with the clinic or the hospital in my area. Now the third one is the health workforce, which you call human resources. Health workforce in health, many people will think about only doctors and nurses. I can tell you, in a healthcare system, it's not only doctors and nurses who matter. It's everybody within that yard or the system. There are many times where doctors postpone an operation. You are ready as a patient, you want to be operated on. But the doctors say, no, we can't do this operation today. Why? Because some people working in the laundry who are cleaning the linen have gone on strike. There's no doctor who can do any operation under those conditions. It's not possible. Or ladies who work in the area where they sterilize the equipment which must get into a human body, whether it's knives or whatever we use for operation, must be sterilized. And it's ordinary people who work in that sterilization unit who burn these knives. If they go on strike, you can't do any operation. So the health workforce consists even of people you might regard as uneducated. It's important. Then the fourth is health system financing. I put it in red because it's the subject of today, this pillar. What is this healthcare system financing, which is put in red, and why is it in red? The fifth one is health information systems. Health information systems simply means to have a method whereby you can trace a patient from one place to the other. You know, it's very funny that science has advanced so much. We've got cell phones, computers, etc. But you won't believe that in many parts of the world, many countries don't have this, including us. We've got health information systems on computers, but we've got none that can help us trace one patient to the other. What does it mean? If a patient decides today to go to this clinic and or this hospital and be seen by a doctor and receive medicine, and decide that I'm not satisfied and tomorrow go to the next one, they will be given the same medicines without anybody knowing. They can collect medicines in 10 different clinics or hospitals. For the same ailment, nobody will know that because we have got no system to link and say, but you have been there. It means, what are the packages through which your citizens receive health care? If a woman is pregnant, what is due for her? What is she going to get to go through a normal pregnancy, to deliver a normal baby with no problems? If the baby is born, what is due to that baby? Having arrived in this world, what is the health system offering that baby in order to nurture that baby into an adult human being like us?